Hello. Thank you so much for joining. I am coming to you today I'm in my basement. Yes, in the basement gym. As you can see, my weights are in the back there, and the walls are unfinished. And this is where all the magic happens the majority of time. All right, so I am Dr. Charmaine Gregory, and I am super excited to talk to you today about the upcoming release of the book entitled The Thinking About Quitting Medicine, Volume 2. And this is, hey, thanks for joining. So basically, this is an amazing compilation. This is the collaborative work of 10 doctors from the field of medicine and dentistry. And we talk about what it means to be thinking about quitting medicine, and ultimately what gets born from that. And so the title of this particular broadcast is Thinking About Quitting Medicine, Dr. Gregory. Okay, so am I quitting medicine? I don't know. You gotta listen to find out. All right, so basically, so I kind of gave you a little bit about the premise of the book. So the book is definitely going to speak to you if you have ever considered have ever gotten to a crossroad in your career as a physician or a dentist. And it will also speak to you if you have not even gotten to a crossroad, but you have just entertained the possibility of other possibilities besides what you're doing on an everyday basis. So it is definitely an amazing opportunity to have a resource from many different voices, and even to look back at the first volume and see all the story and listen and watch all the stories that unfolded there. And you can definitely get something out of every person's contribution. So I'm super excited to be part of this one. And I remember when the first one was getting organized, and I had heard about it a little bit on the later side. I heard about it literally the night before the deadline for submitting, for your application to be part of it. And I just, I wanted to do it, but I wasn't mentally prepared at the time. And I also was not ready to do a project like that. And so I was disappointed that I didn't get a chance to be part of it. So when Manny and Nicole basically talked about doing the second version, I was so excited that I jumped on it right away. So this is just a great work, and it's definitely something that's a resource for all that I mentioned before. And so, and today I'm going to talk about I'm going to try to address a couple of questions so that you can get a sense of where I am coming from as a contributor to the book, and hopefully impart some advice, and hopefully impart some encouragement and upliftment for you. All right. So so I guess the first question is, when did I know that I wanted to be a physician? All right. So for me, it was a long time ago. It was a situation where I was in Jamaica, and I would go to my doctor's office, and my doctor was, a strong person, looked like me, but not all the way like me, but because my doctor at that time was male. And, I just was enthralled with the whole concept of the human body, and probably was, I think the closest recollection I have is probably at the age of 8, when I basically walked into my mom's room and said to her, I'm going to become a doctor. And I made this declaration, and basically was very adamant that that's what was going to happen. I don't care what anybody said, this is what's going to happen. And I didn't make this decision based on a huge amount of knowledge, or even a huge amount of awareness of actually what a doctor does, which is the fascinating part about all this. It was just something that happened when I went to see my doctor, and there was a connection that occurred that just was so strong and lasting that it just made me believe deeply that this is what I would need to do for the rest of my life. And the weird thing was, what can those doctors take us and ask for injections? Like, I literally would go and ask, like, can I have my shots today? You know, this was the kind of kid that I was. And my mom saw that I was interested in this, and so she got me a set of encyclopedias, and they were all about the human body. And I remember, I mean, I can close my eyes literally, and I can visualize those pages. The pages were overlay pages. So, you know, first it had the skeletal system, and then you overlaid on top of that the muscles and the veins and all that stuff. I mean, and the vascular system and the nervous system. I mean, it was an amazing collection of books, and there were 4 books in the set. And oh, hey, Manny. And then, you know, and so I would read through these books and, you know, peruse the pages and just imagine myself dissecting something and just really getting deep into this. And so, you know, the interest started then, as I mentioned, was bolstered by reading and getting exposure through books. So, and again, still no practical exposures besides my pediatrician. And then moved from Jamaica to the States, continued my education here, and then ultimately, you know, went to college. Kind of knew that the end game was going to be med school and medicine. Tried to do the college, the abridged versions, you know, so you can like get admission to both college and medical school at the same time. So I tried that initially and did not succeed with getting into one of those kinds of programs, but then ended up going to the place that was perfect for me, that was right for me, which was Rensselaer Polytechnic Institute in Truro, New York. Big up RPI, yay! You have to give homage to your alma mater, you know how that goes. And so, so I was there, and I literally was still contemplating that there had to be a way in which to go to medical school without having, oh yes, big up CLB. There had to be a way in which to get into medical school without having to take the MCATs, because I was very well aware. So trust me, I'm definitely someone who loves to learn. I am someone who, you know, would consider myself to be very intelligent, but I am not someone who does fabulous on standardized exams. And I learned this pretty early on. I learned this with the PSAT and then subsequently the SAT. And so I had to, despite the fact that, you know, great grades, you know, good involvement in the community and the school clubs and whatnot, I still had to work extra hard at getting a better SAT score to give myself an opportunity to get into, you know, to have more choices ultimately, and perhaps even maybe get a scholarship or two, right? So I literally I took a Princeton Review course. I like studied like I studied like tons of vocabulary words. Cause I mean, for me, like, it wasn't the math that was the problem. It was the English, right? So for whatever reason. And so but I still did like countless problems and countless practice problems in math. And I studied like vocabulary words like every day. Like I was constantly studying vocabulary words, and I was able to improve my score like 200 points. I mean, which is like ridiculous. But I knew how much effort it took to even get that. And I knew that that was not a reflection of what I was capable of, and, you know, my contribution of ideas and meaningful items to any craft that I decided to go into, which, you know, ultimately my choice was going to be medicine. And so I basically did that, and I knew that. And so when I got to college, I said, okay, I have to find the way in which to get into medical school, since the whole pathway from high school straight in, didn't work out, to do so without having to take the MCAT. So I did my research and I found a program, several programs across the country, and one that was actually in my home state, which was at SUNY Buffalo, and I applied to all the programs, and I got accepted into SUNY Buffalo's early assurance program, which allowed for them to use my SAT score as well as my first year grades, right? So I had gotten great grades, and I had pretty much done a lot of the pre-med requirements already, because it's pretty rigorous curriculum at RPI, and I had pretty much done most of the stuff that you needed for medical school already by sophomore year. So I did it, and thank God I got in. And so it was a huge weight off my shoulders, because then I was able to focus on the things that I liked to do, which was learning and not feeling pressured to have to worry about a standardized test, at least for that point. So that was how I ended up in medical school, and basically tried to take advantage of every opportunity that came up. During medical school, I ended up doing a year at the NIH through the Howard Hughes Cloister Scholars Program. So I actually got an opportunity, which was amazing, to actually live on the NIH campus and do research, basically translational research. It was not immediately bed to bedside, but it was in diabetes, and I really enjoyed that year, and it really taught me that it really helped to reinforce my love for medicine, but it did teach me that I probably am not the person that is suited for bench research. And so that was good. That was telling, because that was a time when I was still trying to discover, what was I going to apply for resident, like what field was I going to apply for in residency. So going through multiple changes, initially going into medical school thinking I was going to be the next Dr. Scarpetta. I don't know if anybody reads Patricia Cornwell, but she's like one of my favorite authors, and she writes about a medical examiner in the Virginia Commonwealth, and who basically is amazing. And she she goes and she does all the things with the bodies, and she figures out what the mysteries are. And then she, outside of that, does the investigatory work to figure out who actually, caused the demise of the person. So I had all these grandiose thoughts that I was going to be the next Dr. Scarpetta, and that did not work out. So, but that's fine. So, medical school basically was a great experience. It had its ups and downs, as anybody will attest to who's been through it or is thinking about doing it. But it's not, despite trials, despite ups and downs, still you push through to the end, right? So I did, and I found something that I loved, which was emergency medicine. And then I went ahead and got into residency, and been practicing now for 13 years. And, that is really my story as far as medicine is concerned. And then so to address the next question, which is, what do I enjoy most about being a doctor? And I have to say that the thing that I really enjoy is being able to interact with others. And I think that, we can interact with other people on so many levels, but there's nothing that is more, I don't want to use the word intimate, but it is kind of a suitable word. There's nothing more intimate than being able to help somebody on their most, on a day when things are just not going right, and being able to figure out what the problem is and then offering them a solution. I think that is what I really love about it. And then now, and with my profession and with my specialty, there's definitely some give with that, because there are times when obviously my patients come in and they're in extremis and there isn't any conversation that is had. It is basically, critical actions, and let's get this patient through this time and get them to the next station in their medical journey. And so there's that. But then in between there, you have many times. I mean, I can even think of a most recent shift that I worked, that I was able to just talk with a patient about, what was really going on with them, because people sometimes think that the emergency that they present with is the real emergency, but sometimes it is not. Sometimes there's so many layers to the emergency that if we were to get to that next layer below and fix that problem, then it would prevent future emergencies from occurring. So I know that sounds kind of vague, but I guess a concrete example would be the diabetic who comes in diabetic ketoacidosis, which, you may or may not know. I mean, if you're medical, you would know, but if you're not, basically it is a situation where there's not appropriate consumption of glucose, and basically the glucose then stays external to the cells and causes a lot of problems. Causes you to get into an acid state, and cells do not appreciate being in anything but a neutral environment. So, it can cause a lot of different problems. And so anyway, this is a huge emergency for people who have diabetes. Okay. And this one particular situation that I think of, the person ended up in this situation mainly because they were unable to access the medicine that they typically take, which is their insulin. And because they weren't able to access that, it put them in a situation where they could no longer manage the sugar appropriately. And so then they ended up coming in this emergency state. So, by going back and trying to troubleshoot how to correct what the initial problem was, really helped that person to not present to us again in that state. So that's just an example of what I mean. So as a physician, and particularly as an emergency physician, I feel like a lot of what I do is troubleshooting. A lot of what I do is problem solving. A lot of what I do is procedural, in the sense that it's, we're doing things to help people. But those are the things that I really, really enjoy about medicine and being a doctor. And then the next question is, what would I tell my younger professional self? I would say that definitely I would tell myself to speak up earlier. I've learned to utilize my voice later in life, in this timeline. I mean, I'm only 43, so it's not like it's, super late, but, it would have been nice to have found my voice earlier in my career. I think that might have allowed for for me to be further along in the trajectory than I am currently. And, but at the same token, I still feel like sometimes you don't find your voice until you're absolutely ready. And so perhaps I wasn't quite ready yet to not only find it, but utilize it. So that may be part of it. And so I think I would just tell myself not to be afraid to find your voice and then use it, because you have a lot to say. And this is me talking to myself now, and I'm actually talking to you too. So you have a lot to say, and people want to hear it, because no matter what you think, and this imposter syndrome thing is huge, you have a lot to offer, right? And so speak up earlier. Yes, Manny. All right. And then the next thing that I wanted to talk about is, so when do I plan to quit medicine? All right. I've been waiting for the whole broadcast to hear what my answer is. I am not quitting medicine. All right. So I'm not quitting medicine. I love medicine. I really feel like this is what I was meant to do. And it may be that it's a different iteration at different stages, but I'm still going to be here. I'm not going anywhere. Oh, man. And so for me, if I were to basically say, well, what is my meaning of the phrase thinking about quitting medicine? I feel like that phrase it's not a concrete concept, right? It's not something concrete. right? It is really a concept. And what I mean by that is, you will get to these points where you kind of, you're standing and there's 2 paths, maybe 3 paths, maybe 4, I don't know. And you're like, which one is the right one for me? Do I stay on this path where I'm, seeing patients every single day, I don't know, 40 hours a week or however many hours a week? Or do I decide that I'm going to get involved in advocacy and get involved in the politics of medicine? Or am I going to do some work as a consultant, where I use my clinical acumen, but use it in an administrative type of way and allow for the voice of the clinician to be heard in industry, or do I decide that I'm going to start a business where I may be doing the thing that I have been passionate about, but have been put on the back burner because I have been pursuing medicine? Let's just say, thinking about quitting medicine is not literally quitting medicine. It is just rethinking what you're going to do with the skills you have learned in medicine. So, for many of us, it's, we reinvent ourselves and we do something in addition to what we do every day, seeing patients at the bedside. For others of us, it may be that we walk away from the bedside and then we are doing something still within the realm of taking care of doctors or taking care of patients, but not a direct touch to the patient at the bedside. So, we think, and most physicians don't even consider an alternative besides that, seeing a patient at the bedside every single day or seeing a patient in the office every single day. Most physicians don't consider that because we're not introduced to that during medical school. That's just not part of it. The medical training is for one goal and one goal only, and that is for you to get done with what you're doing and start seeing patients. That's just the bottom line. There is no alternative thinking is introduced to you. There's no, let's explore all the opportunities that you can use the MD degree to, or the DO degree to be able to be part of and participate in. There is no thinking outside the box as far as developing your own, whatever that is, whether it's designing clothing, whether it's, providing a service, whether it's, doing some community-based work. You're not taught that. That is not part of the education. It is the hidden curriculum that you discover as you're out and about as an attending, and then you may fall into the situation like I did, where, I got to the point where I was burnt out and I had to crawl my way out of that abyss and then find my way. And then as a consequence of that, of being at that crossroad, being able to find the joy in helping the people that I initially set out to help and doing the thing that I initially set out to do, not even realizing it as an 8-year-old in Jamaica, looking at her encyclopedias of the human body, leafing through those transparencies, overlaid, and loving every minute of it. That's what it is. That's what thinking about quitting medicine is. Exactly. Rethink, reinvent, define your own. Find your joy, find your path. Absolutely. I agree with that. CLB. I'm not sure what your full name is. I don't mean to refer to you as CLB, but I'm just looking at the comment here, and I'll put it on the screen. All right, so that's all I have for you today. I just wanted to get on and just kind of let you know a little bit about me. And I wanted to encourage you to keep an eye out for the book as it comes out. It is going to be phenomenal. And I don't know if you've had an opportunity to take a look at the other live broadcasts of some of the other authors. I know Dr. Ray did hers, and Dr. Zarina did hers, and I believe there have been a couple of others. So definitely check those out. And you'll get something from it, no matter where you are and what stage you are in the game. Whether you are getting close to that crossroad, you've been at the crossroads and you passed it and you're still not sure, or you've been at the crossroad, found your path, and you just want to see how others have made it through. So hopefully this was encouraging to you. And I always like to end broadcasts with my favorite saying, and almost like a battle cry, and it is, be strong, be brave, and unleash your greatness. This is Dr. Charmaine Gregory signing out.